Hello, welcome to the Healthcare Facilities Network. I'm your host, Peter Martin from the Healthcare Facilities Network and Gosselin Martin Associates. As always, thank you for clicking on this video, which is actually episode 2 of Attract and Keep Healthcare Facilities Management Talent. This is part of our Filling the Pipeline series. If you missed the first episode, you can find it in our Filling the Pipeline playlist on our YouTube channel, or just search Attract and Keep Healthcare Facilities Management Talent, episode 1. I'll also link to it at the end of the video. You know, when we created when we rolled out the Healthcare Facilities Network in April of this year, this is the type of show that I had in mind. Now, every show we've done is the type of show that we've had in mind. But what I like about this particular episode is that we have a diversity of experience on it. So for this episode, we have 2 healthcare facilities management professionals, Clay Ciolek out in Washington State, Jordan Smith down in Florida. They talk about the challenges they face keeping and recruiting talent and how they go about it and succession planning. We have Nancy Vanasse on this episode. Nancy works at Maritime Academy here in Massachusetts. She works with college students, so her perspective is a very good one. What are college students looking for? Who do they want to intern with? So she talks about that. And we have Stephen Call on, Dr. Stephen Call. Steve is at Washington State University. Steve has done a lot of research on salaries, on competencies. And so we have these 4 folks together, and they're all able to add a perspective. And as I said, when we created this channel, I'd hope that a program like this one makes its way up to HR somehow, or to C-level leadership somehow, because we hear from the people in the field who are dealing with the challenges. Not that human resources isn't, and not that the C-level isn't, but if we can create some alignment, and if this type of an episode helps to create the alignment, then that is what we're looking to do here on the Healthcare Facilities Network. So that's enough of me talking. Let's go over to episode 2, Attract and Keep Healthcare Facilities Management Talent. As always, thank you for clicking on this video.
Clay, I kind of want to pivot here, because one of our goals for at least this session, and we spent a good amount of time on the first one, which is good because I think there's a lot of good discussion. Every time you talk about it, there's not just one issue to solve for, right? There are many of them. But I had asked our panelists to consider, 3 questions for this particular session. And let's assume kind of blue sky type thinking. If we wanted to help fill the pipeline, what is important to help fill that pipeline? What do we need to concentrate on? What should stay the same relative to what are we doing now that's effective, whether it be mission, but then also what needs to change? What needs to change to better fill the pipeline? And Clay, the reason I just kind of wanted to go to this slide right now is because you talked about my 2 things that I had relative to change. My first one is at the organizational level. And my second one, and I think I might be a little bit more grassroots, and I'd love to hear what you folks were thinking. My first one was the organizational level. I think it needs to change a little bit. And my second one was at the messaging level, the reach level, using social media, just using all of these different avenues that are out there to try to spread the message. I mean, and it might not work for 5 years. You might not get one of Nancy's students until 5 to 10 years down the road, but at least the seed is planted that they can come into this opportunity. I mean, Jordan, you didn't start in healthcare facilities management, but just to elaborate on the organizational level, and then I'll stop talking. Clay, I've seen organizations that do that, where they'll hire a person, but they don't disclose kind of what's behind the curtain. And then they bring them there, and that candidate says, "Oh my God, you didn't tell me this." And they lose that person. And so I think not all organizations do that, of course, but I think organizationally they need to not they need to, because they don't really need to do anything, but through that interview process, you need to disclose the good, the bad, the ugly, give that entire picture of what a person is walking into, because these days candidates will leave, and rightly so, if they feel that they've been hoodwinked, I guess is a way to put it.
Well, I would hope that whoever is hiring someone at a facility or director management level can articulate exactly what you said. And that would be interesting to see if someone really can do that. Because there'd be a lot to talk about in terms of what we're expecting, regardless what it says on paper about you.
Exactly. And that's, I think, where candidates too, just doing research and, as much as they can to uncover relative to hospitals and systems. Anybody else have anything to add? I talked there for a little bit more than I wanted.
Well, I'll jump in. Some of our best technicians have come from vendors and other relationships that we've had, right? And so maybe they are working an insane amount of overtime, trying to meet all their calls or something else, and they're looking for more routine and stability in their lives, and the hospital sometimes is a good fit for that. And so we've had our best luck with trying to recruit some of the people that we're already familiar with and already understand what it's like to work in a hospital with infection control concerns and everything else.
Do you find is there an age group? Are those like mid-career people, or is there a specific demographic you would seek where you feel they're at that level, Jordan?
For technicians, it's very difficult for me to get somebody in the family stage, right? So if they're trying to grow their family, they need to go out and earn, and that's not a good fit for a hospital environment. There are places where you can go make more money, but especially here in the South, where it's going to be 100 degrees, and almost all of my work is air conditioned work.
Yeah,
that's very attractive to some people at different stages in their career, right?
Yep.
And so it's finding that right fit at the right time, and that's where we found that we've been most successful.
Is the market pretty nuts down there right now?
Yeah.
Yeah.
There's 1,100 people a day moving to Florida right now.
1,100 people a day. Wow.
Every day moving to Florida.
That's interesting. And you've got a lot of competition.
Very much.
Yeah. Steve?
These questions are so big, I'm not even sure where to start, but I'll talking about management, I'll say there are some fundamental things that need to change. And we can talk a lot about how do we get the word out, and how do we track people, and but the reality is, until this issue of pay changes, is going to be an uphill battle at every level. So that's something that has to be attacked. And so what can we do as facility leaders is having the information. So when HR goes out and does their market analysis, we can say, well, time out here. We also need to be looking at at pay beyond the healthcare setting. So that's just, we just need to be empowered to have information that can be helpful. For example, IFMA just published a global compensation report that looks at different job levels in FM in different industries. So that's just one, right? That's just one example. I mean, how many healthcare facility managers are aware of that study? I don't know, but those are some things that I think we could do as an industry, is just make ourselves more aware of the information that's already out there through ASHI, through IFMA, through BOMA, through APA, right? That just is helpful for us. And then the last thing I'll say on this, I could talk all day about challenges and opportunities, but really needing to eliminate some perceptions that are just frankly inaccurate. One of those perceptions is, to be a successful facility manager, you have to have decades of trade experience. That's a perception that is inaccurate. Now it's helpful, but the data shows that if you come in to healthcare FM with no trade experience or with trade experience, it doesn't really change the trajectory of your growth or your pay. And so a lot of the times we don't look at new college graduates or folks that have great potential because they don't have healthcare specific trade experience. So there's just some things that if we kind of broaden our horizon, gathered more information, that we could actually be I think, address some of these fundamental issues and put some changes in place that could actually make a big difference.
So I don't know, Steve, if your research focuses on this or has looked at this, but what does the data show is one or two of the most important factors to success?
Well, I don't know if I can directly answer that question, but if you're looking at, for example, entry-level facility manager in healthcare, there's about 10 competencies that are expected for that role. If you compare a candidate, the traditional candidate that's been a maintenance technician or electrician for a decade or 15 years, that's vying for that role, or let's say you look at a new college graduate from a facility management, facility engineering, or construction management program, very different skill strengths, right? So the technician is going to have some really strong maintenance skills, but the college graduate is going to have some other, maybe more stronger soft skills, right? Data analysis, whatever. That's just an example. And they are all promoted at the same time. They all have the same promotion time frames, regardless of their strengths or weaknesses. So I think the key is to recognize, as it was mentioned earlier, there's no perfect candidate. You just have to know what competencies you're looking for in that role and what gaps there are, and then developing a formal training program to address those competencies, whether that's internally or externally. Having a program that you're like, okay, these are the 3 skills that you need to develop, and this is, as an organization, this is how we're going to help you achieve that. So I didn't directly answer your question, but that's that's an idea to help us kind of keep moving forward.
Peter, could I tag on to that?
Of course.
I think we're beyond the point of requiring hospital experience, and I'm picking up that from Stephen, where sometimes I think it's appropriate to say hospital experience preferred, but maybe not required. And came across a situation, someone in my office this week where he's my electrician, and is a senior electrician, has been an electrician all of his career, and is about halfway through that, and he's with us. So he'd never worked in a hospital before. And we've asked him to fill in on some things and to take responsibility for things that required in testing and inspection and documentation that was part of our accreditation process. And he came to me because we had a situation that occurred, and it wasn't even necessarily his responsibility, but it's part of a system that he's trying to look after. He wanted to assure me that he says, I feel beat up about this situation. I said, why? Who's beat you up? I said, is it me? And he says, no. I said, is it yourself? And he said, yes. And I said, well, look, but I did, what I wanted him to understand was that, he, and what I was recognizing was that he was applying himself. He was engaged with the situation. To me, what's important to your blue sky question that's a common denominator for me is a behavior that you can't tell ahead of time, but it's a behavior you can observe, and that's character. And that's what he was exemplifying to me. And if I had the choice between someone who was had a technical ability and didn't have hospital experience, but it demonstrates the character, he's the person.
Interesting.
That's what I hired.
Yeah.
But that comes over time. But sometimes people's reputations follow them, and sometimes hospital organizations or professional organizations that surround them, it's a tight-knit community, and word travels, and you can kind of pick up on what's going on. But nevertheless, I see no substitute for that character. How we can manage our questions and our interviews around that kind of a thing would be interesting.
This is Peter Martin. If you or your organization is interested in advertising or partnering with the Healthcare Facilities Network, including sponsoring content, then please email me using the barcode in the lower right of your screen. From the trades level to the vice president level, from planning, design, construction, project management, compliance, safety, and security, the Healthcare Facilities Network reaches FM people where FM people are.
Well, to build on that too, I mean, it's where, when you hire an electrician to work in a hospital, and especially if they're coming from the field, you're going to ask them to do things like work on generators that they probably don't work on, right? If you hire a plumber, you're going to ask them to manage your fire sprinkler systems that they probably have absolutely no experience with, right? And so it's that attitude, that willingness, that what goes beyond the resume that you're looking for and you need.
That type of person is the teachable one.
Yeah.
Trainable. And that's where we have to make up deficits. But we don't have the luxury of finding that person that ticks all the boxes.
Do you feel, do you folks think that so you can hire the technician in without healthcare experience? What about hiring somebody in at a manager level or above without healthcare experience? Does that change your thinking, or does your thinking change at the manager level or above?
Would for me.
It would for you?
Yeah. They got to know what they're walking into.
Pretty simply said there, Clay.
Well, if there's processes you don't have in play,
yeah,
a year at a time, you're sunk.
Yep. Jordan, you agree?
Yeah, so I've talked about it in the past. I've hired folks outside of facility managements to come in and be leaders. This specific person I'm talking about was a project coordinator first, helping out on some construction projects. So she had an opportunity to learn the hospital and learn the game before she was in a full-fledged manager role. So it's so I think that you can do it, but I think that you're kind of asking people to take a step backwards, and they kind of have to do that middle tier role before they're ready to be that full-fledged manager. Because I don't disagree with Clay. I mean, there is a lot to learn and a lot to know. And if you're walking in cold off the street, man, that's a lot to learn.
You said it well, Jordan.
Nancy, I know I just wanted to circle back as the guys were talking just about competencies required, and competencies are only increasing, they're not decreasing. From an academics level, from a school level, from a preparing those college students for the workforce, how often does a college reassess what they're teaching to make sure that the curriculum they're providing the graduates fits what is needed out in the workforce?
So, I do know a curriculum change does take a while to change because it has to go through a huge process. But I know it does happen. For example, what is it? AutoCAD and Revit? Like they're looking to add Revit to the curriculum. And so it has to go through, certain channels for it to actually be added to the actual academic program. It does happen. I know our school, every department has its own advisory board. And so that advisory board consists of people out in the field that are making their recommendations. And so, they'll do things accordingly. When our students go out on co-op, supervisors have an opportunity to evaluate our co-op program. And at that point, they can also make suggestions, maybe a student needs to learn a little bit more here, or they're really strong in this area, or whatever the skill may be. So they also can make some changes that the department chair does see as well. But I think a lot of it starts at the advisory committees. Changes do occur. It may not be as quick as, say, a private company, but it does, and it can happen.
Okay, thank you.
And I'll just bring up, it's kind of this vicious cycle, because you have industry advisory councils at a university that are there to kind of say, this is the content that the student should be learning. But why would a university adopt regulatory compliance type education for students that aren't being hired in healthcare. And so it's this kind of chicken or egg situation of trying to get some of these healthcare specific competencies taught in FM programs, but healthcare FM isn't hiring from colleges or universities. So it's going to be interesting to see kind of who's the first one to kind of invest in that. Frankly, I think the industry needs to show that they're willing to invest in students, and then the universities will quickly adapt to that.
Yeah. So we have in our 2 remaining minutes, a little bit less, just a final question, and I'm sure we'll continue this discussion, but I always like to go to what do you think needs to change? So I've kind of skipped the first 2 building blocks, but if I said what needs to change again, I would go back to, I think, the organization first, because I think, as you said there, Steve, if the organization fundamentally is not aligned, that's going to go that's all the way down the line. So I would say fix, organization level, not necessarily fix, kind of adapt, and then getting the message out, blasting the message far away, because it's going to take time. So I would go with the organization and the reach. Nancy, I don't know if you would have any an answer to it, because you're not involved in the industry, but from your end, anything that you would change that you think?
Sure. I mean, I think from my end, where we do have some students working as interns in some of the area hospitals, in healthcare facilities, I think it would be a great opportunity for some of those organizations to consider hiring, either from those internships, from our career fairs. There are a few who do or will hire directly out of college. But I think overall, I know it is a challenge for hospitals to hire fresh out of college.
Yeah, it is.
And that goes back to career architecture and having that architecture in place that hospitals we don't do a good job with it.
Yeah. I was just wondering, as you were talking, I wonder if you can if you can get a commitment from a kid, maybe you bake that into the internship process and lead them in. But anyways, okay, thank you. That's a great answer. Thank you, Nancy. Why don't we'll go Clay, then we'll go Jordan, and then Steve will go with you finally.
Oh boy, what needs to change?
Sorry.
Yeah, for those of us, I think, that are getting up in years, I would love to have the ability, the time frame, the bandwidth to be able to work myself out of a job and somebody with me for a long time for a success planning. It's just like the example I said earlier, where they're going to chop for money, they take it right out of support services. But I don't see it as a waste of money to have somebody that can be your shadow for whatever time is required, and then being willing to walk away. I think there's a difference between for-profit and nonprofit. And I think the people that I've seen working in nonprofit situations, they really care about the facility, what they do, and take ownership, and they want to see it improved.
Yeah.
And if they're being constantly just pulled saying, no, we can't do that, we can't support that, there's no money, bottom line, then it takes away all the aspiration.
Yep. I like that answer. You talking about that succession plan, because not a lot of organizations are doing that. Jordan.
Well, we kind of said them, just, succession planning and that job architecture. How are we creating that pipeline to develop that talent, and then, which feeds right into succession planning.
That's a topic I'd like to delve into in the future, that kind of creating that job architecture. How do we go about creating that, and what does it look like? Thanks for that. Steve.
I'll piggyback off this job architecture comment. I think that's a really interesting comment. Instead of doing internships, using what healthcare already does for their administrative type roles, which is a fellowship program. So in essence, you're hiring students, you show them there's a path forward. Maybe it's not the highest pay, but they understand, wow, this is a really awesome opportunity. I'm going to get great training. So looking at fellowship programs versus internships, because internships historically have not worked for a number of different reasons. And then secondly, what can change is formal training and development programs based on competencies, technicians as well as managers, especially in technicians, where we're having a really hard time bringing in even general maintenance type roles. Find folks that have very limited experience, have a program 6 months to get them trained up internally, because there aren't any external programs available. Formal training and development programs that hospitals adopt internally would be a huge boon for the industry.
Yeah. Well, gentlemen, I appreciate your time. Nancy had a run. You saw that she disappeared. She told me she had a hard stop at 12. So I thank Nancy, Jordan, Clay, Steve. Thank you for your time this morning. Any final thoughts before I close this off? I know you guys got to get running, lots of meetings. That's the other thing about this role, right? You're meeting all the time, but any final thoughts? Otherwise, we will sign off.
No,
Thank you,
great
Peter,
discussion.
for-
Thank you,
Peter.
everybody.
Thank you
care.
all. I
Bye-bye.
appreciate your patience.
Bye-bye.
Thank you for watching this episode of the Healthcare Facilities Network.